A sudden, unexpected death to a person in your care, an accident involving a co-worker or someone you know that results in injury or death. These are examples of critical incidents. Unexpected events like these in the workplace may have a devastating impact on the lives of your co-workers and seriously disrupt your workplace. As a manager or supervisor, you may be in a position to help your staff cope with the effects of these critical incidents immediately after they occur. The purpose of this video is to provide you with a few simple skills you can use to assist staff after a critical incident. In this video, we will discuss what a critical incident is, how to recognize the signs and symptoms of critical incident stress, and what you can do immediately to help workers suffering from critical incident stress. And we will show examples of how to go about approaching staff who may be suffering the effects of critical incident stress. A critical incident is a sudden, powerful event, like an accident, injury, or fatality, outside the range of normal experience. These events are outside of a person's control and can cause emotional or psychological trauma. The effects can result from either direct or indirect exposure to the event and can overwhelm an employee's ability to function on the job. People who experience a traumatic event may feel guilt, anger, or fear, while others may blame themselves for the incident. They may become distracted or unable to concentrate on their work, risking their safety and the safety of others. They may suffer extreme emotional upset at the time of the event, or the effects might be felt after a period of time has passed. Some people may feel an impact but recover well without intervention over time. Some common signs of distress to watch for include anxiety, irritability, and moodiness, difficulty concentrating, making decisions or thinking clearly, trouble being around people or being alone, anger, crying, and difficulty going back to the place of the incident. People may experience some or all of these reactions. They are common responses to stressful or abnormal events. After a critical incident, staff may become disillusioned with their workplace if they believe that their problems are not being taken seriously, or that they are not being given adequate support, and a valuable skilled worker might be lost. Dealing with a critical incident may involve one or more of a few possible interventions. As a manager or supervisor, you are often the first on the scene and the first point of contact for persons impacted by a critical incident. You can help mitigate the effects of critical incidents on your workers and the workplace by responding sensitively with some knowledge and a few simple skills, with an intervention we call an individual check-in. The check-in should occur after every critical incident and can be one of the most important interventions to occur. It involves informally speaking in a non-judgmental and supportive way with any staff that may be impacted by an incident. The goal is to check how staff is doing, to offer support, and to determine who needs further help and what other interventions might be useful. A well-timed and executed check-in can reduce the emotional charge generated by an incident and support your staff as they resume their duties. It demonstrates to your team that you acknowledge and recognize what they've been through, and that you are concerned for their well-being. The primary goal of this video is to emphasize the importance of your role as a manager or supervisor in checking in with staff after a critical incident, and to provide some simple skills to increase your comfort and effectiveness in this role. We will return to the skill building portion of this video later, but first, some information about what happens after the check-in. Firstly, it's important to familiarize yourself with the critical incident stress management services available through your organization. This is either your Employee and Family Assistance Program or a critical incident stress management team. You should have contact names and numbers available and call as soon as you can to seek help in assessing what interventions are most appropriate or needed. There are several intervention possibilities. It may be helpful to arrange a group diffusing or debriefing for any impacted staff. Individual help for staff that are particularly affected or who may not wish to participate in a group can also be arranged. Follow-up services will be available for ensuring that any continuing concerns are addressed. Again, your Employee and Family Assistance Program provider or Critical Incident Stress Management Team coordinator will help you assess the situation and determine the most appropriate interventions. These interventions, which follow your initial check-ins with staff, are all provided by trained professionals. A few important points to remember. Critical incident stress is a common reaction to an abnormal event. There is no one way to react to critical incident stress. There is no one way to recover from critical incident stress. Participation in diffusings, debriefings, or individual counseling is always voluntary. Affected staff may be encouraged but not mandated to participate. Check with affected staff after an incident to determine interest or need. Critical incident stress management is separate from any operational review or investigations of an incident. Standards of confidentiality apply as they would in any counseling services. Most importantly, remember that your role in doing the individual check-in with staff is crucial in beginning the process of dealing with the stress that may occur as the result of a critical incident. You are not expected to counsel. Your Employee and Family Assistance Program provider or Critical Incident Stress Management Team coordinator will assist in getting other services in place. Your concern at this point is only to support the well-being of your staff. Now, let's return to learning those specific individual check-in skills. Firstly, identify the staff members most directly and immediately impacted by the incident.
Oh, hi, Betty.
Look for the signs and symptoms of critical incident stress in your group, and remember that all team members are impacted to a greater or lesser degree when a critical incident occurs.
It was awful.
It's important to listen carefully. Remember, just the fact that you are taking the time to listen to your workers will contribute to the normalizing process.
Do you want to come to my office for a minute?
Have you got time?
Yeah, sure.
I'd appreciate
Would you come
that.
now? Let's go.
Secondly, arrange to meet staff in a quiet area away from the incident. Try to find a small room or office nearby where you can talk in private.
Betty, I've known you a long time, and I know you've worked in Emerge for quite a few years. I've never seen you so upset. What happened this morning?
Validate what's happening. You could say, we've just gone through a tough situation.
And this one got under my skin.
Don't ask feeling-loaded questions. Ask about the person's immediate reactions to the events that have occurred. Reinforce any activity that seems to help calm the person. Also, keep in mind that sometimes a glass of water and a box of Kleenex can be supportive.
I just feel scattered. I feel like I can't focus. I feel like this floaty feeling. It's,
Normalize the feelings they express. Let them know that their reactions are a common response to an abnormal event.
Maybe you've never felt this to the same extent before, but this kind of reaction actually is not that unusual. It probably hits all of us at some time in our lives. And it's perhaps completely understandable in the circumstances with the connections that you had. Given how you feel at the moment, what's going to happen for the rest of the day?
Well, I'm supposed to. I've just got a few just sort of insurance physical things booked in my office this afternoon.
Limit your advice to suggestions that are immediately related to their safety and well-being.
I was going I've just been
You
so
might give them
caught
some
up in
time
this.
away from the workplace.
One of the things that often happens, though, in these circumstances is that we find it very difficult to focus.
It's just overwhelming completely.
Betty,
Evaluate
I
whether
give you a
staff
little
can
advice
carry
here.
on with their
I
duties.
would suggest you don't do the afternoon session. If you like, I can phone your office, talk to your staff, and maybe reschedule those appointments for you.
Yeah.
Now, if you agree, I would suggest that you go home and just take care of yourself.
If you decide to send them home, make sure they don't go home alone or by public transit. Arrange a carpool, taxi, or have a family member pick them up.
Can you make arrangements to get home?
Well, I was going to get my boyfriend to pick me up. I like.
Good idea.
I just don't want to do that drive.
The other thing is, as you well know, sometimes these things linger. It's not just the acute reaction that you
Follow up with the individual a day or two later and provide the opportunity to meet individually or as a group as needed. If you have concerns about an individual, consult with the Employee and Family Assistance Program or your Critical Incident Stress Management team.
Okay, so let me phone your office and I'll deal with
If you
that.
do that, that'd be great.
Try to ensure that they will have someone at home when they get there. If they are going to be alone, encourage them to have a friend or extended family member come over, or arrange to go to a friend's or extended family member's home. You might ask them what they have to do when they get home. You can also talk about ideas to help at home with kids or other responsibilities. Let them know that it's okay to ask for help. Now that we have an idea of how to approach staff after a critical incident, let's see how this check-in can work in a real situation. In a hospital emergency, paramedics have just brought in 2 young people from a serious motor vehicle accident. A 17-year-old female who is dead on arrival, and a 19-year-old male who arrests and dies while in emergency. This is the 3rd motor vehicle accident in a month. The nurse who dealt with the 17-year-old female DOA says she's fine, even though the DOA suffered extensive and severe injuries. Later on in the day, when you check in with her, she says that she can't go near the trauma room.
Hi, Anastasia.
Hi.
I understand that we had quite a difficult situation this morning, and I'm checking in with everybody, and I just wondered how you were doing.
Okay, I think. I don't know. This is the second MBA, and these kids come, all dead on arrival, and the one that I had, she's 17 years old. I have a daughter, 17, so I think it's hard. It's equally hard, and I can't just help but think, that could have been my child, So it's kind of hard for me to kind of focus, and you can't just think, that could have been my daughter. So I think I had it all together with the other 2, just finish your thing and then go on with it. But I think it's all kind of coming
Good,
back.
yeah, good. So I'm wondering
all
if
at
maybe
once.
you and I could go to a quieter room and just chat.
Oh, okay.
Okay, let's go this
Thanks.
way.
Yeah.
So Anastasia, I know that was a very difficult situation, and as I said, I was just checking in with you.
Well, I thought I was doing okay, until you came, and it just, it's been very upsetting. This is our second, MVAs that came through with these teenagers involved, and it's the 3rd time, and I think this time around it's been harder because I have a 17-year-old daughter at home as well, so it's, you can't help but think that could be my daughter rolling in and, this happening, so that's part I'm just having a really hard time coping, with, so.
So I think it is quite normal to have those kinds of reactions, especially when you kind of make a personal connection to that young girl.
Yeah.
I'm wondering about you taking a break, or even about maybe going home for the rest of the shift.
Oh, yeah, I thought it was okay, but I do have difficulty just kind of focusing on what I'm supposed to be doing, because I'm just reliving this whole thing over and over again in my head. So I don't know, maybe, yeah.
Okay, okay. How did you get to work today?
I drove.
Okay,
Yeah.
so you've got your car in the parkade. Okay. Is there someone that we could call, your husband, that
Yeah,
could
I
come
mean,
and pick you up?
I can try calling him, and if not, I think I should just take a cab home. If I can't get a hold of him, I don't think I could drive.
Okay.
Yeah.
Well, why don't we get that organized and I'll go out and talk to...
It's the only thing is I have patient alone.
I know.
There are other patients that I have to look after.
Yeah,
So.
and I know that's really important for
yeah.
you, but I'm also hearing that you're feeling a little bit distracted, hard to concentrate, and so I think it might be the best for you to go home, because I am concerned about you.
Okay. Thanks. Yeah.
I just, maybe what we'll do is I'll call you a little bit later on and just check to see how you're doing, and there are other resources that you might be able to access, such as the Employee Family Assistance Program. They offer confidential counseling, or maybe talking to your family doctor. And also, maybe we'll see how this, I'll talk to some other people, and maybe we can see if we can get a group debrief organized in the next couple of days.
Okay.
Okay. So why don't I go out and we'll make arrangements to get you home.
Okay. Thanks.
Okay.
Let's review what the supervisor has done to manage this situation. Try to get the employee to a quiet area away from the scene. Acknowledge the difficulty of the situation. Let them know that you are concerned about them, that you care. Normalize the feelings they express. Let them know that their reactions are a common response to an unusual situation. Reinforce activities that seem to help the situation. Be non-judgmental. Ask questions to determine what their personal needs are right now. Support in the moment may be sufficient to let them return to regular or modified duties. If need be, work out a plan for getting them home. Let them know where to go for more information or confidential resources. Employee Family Assistance Program, Critical Incident Stress Management Team, or Family Doctor. Contact Employee and Family Assistance Program or your Critical Incident Stress Management Team coordinator for support or consultation regarding the merit of further interventions. A sudden traumatic accident or incident could happen in your workplace at any time. Unexpected events like these may have a serious impact on the lives of your staff. As a manager or supervisor, you are in a position to help your staff cope with the effects of critical incidents immediately after they occur. By taking the time to apply a few basic skills, you can support your staff, starting them in the process of dealing with an incident and offering more resources as needed. And remember, while you're taking care of your staff, it's also important to be sure to take care of yourself.